We're going to do a repeat cesarean section, breech presentation. You can see the patient has a pendulous abdomen, so we're going to need some retraction here. So we're going to use the Mobius Retractor. First thing we're going to do is we're going to do a phalansteal skin incision. Now we're on the fascial layer that we're extending to open. There's a delay on that side.
You want this side or that side? Here. Yeah.
Turn your back. There you go. Going to dissect the fascia from the rectus muscle. Previous C-sections are a little tricky and tough. A lot of scar tissue. We're separating the rectus muscle to give us more exposure. Into the peritoneum. Making sure there's no adhesion. She's a previous C-section. Doesn't have any adhesion.
Let's have it now. Let's have the retractor, please.
In this particular case, we're going to use the extra large Mobius. Give us more exposure. Baby's breech. So we'll be able to use a breech extraction. Again, what we will do is, there's a flexible ridge here. We put through the incision in the peritoneal cavity, making sure it's free of adhesions. This retractor is great. Normally, you can also use it by yourself without having a partner. In that particular case, you will do 11 o'clock, 1 o'clock, and then just continuously going up, down, around. So you can see if you were in surgery by yourself, you necessarily didn't need another assistant to kind of help you use that. And there's an excellent exposure of the uterus here, free of adhesions, and we'll do the uterine incision.
Okay, very good.
Uterine incision.
Thank you.
Standard scissors. So, baby's breech. Breech extraction, both legs. Have a wet towel. Nice size tip. What we'll normally do here is rotate the arm and the body. Rotate. Bring up the baby. There you go. And if we're gonna, that one's looking better. Can we get this one?
You came out.
Actually, in that particular case, it's really interesting. It's an abruption. The placenta came out as well. But
Yeah.
as you can see here, you can clean the uterus with another clamp.
Where are you? Where are you? Give her the stitch.
Congratulations. Actually, you can do all your suturing here without trying to look for the pedicles or anything of that nature. Do not have to exteriorize the uterus. Very good. It's easier for us to see the uterus. You can do your layers without any problems. Good retraction, excellent visualization. As you can see, if I didn't have an assistant, I would still be able to do this by myself. So I can sew the uterus back on itself without any problems. What I'm doing here is just putting a second layer over the uterine lining. to aid in excellent hemostasis. We have excellent visualization. Hematoma without any difficulty, no panic. So you can also take a look at, you can see the ovaries in the tubes without any complications. Normal tubes and ovary.
Excellent.
Again, we check the incision.
All right.
So we check all gutters.
and
Everything looks
dry.
fine here. Again, we check to make sure that there's no bile. We remove the retractor without any complications. And the procedure is essentially over.